Hello again. This is Informed Choice, Part 2. Listen to these former abortion clinic workers. First from Joy D. We had to know exactly what we were doing when we were talking to these women. We had to find out very quickly what their problem was, play on that, and get them in the clinic for an abortion. We were very good salespeople. And this anonymous worker. The counselors were trained in what areas to cover and which to avoid. Their task was to keep the machinery moving, to get the women into the procedure room as quickly as possible. And this from Nora E. We always wanted to know the sex, but we lied and said it was too early to tell. It's better for the women to think of the fetus as an it. And this from Kathy S. Sometimes we lied. A girl might ask, was it a baby yet? Even as early as 12 weeks, a baby is totally formed. He has fingerprints, turns his head, fans his toes, feels pain. But we would say, it's not a baby yet. It's just tissue, like a clot. Or this from Charlotte T., a former abortion clinic administrator. We were hiding from the women some of the pieces of truth about abortion that were threatening. It is a kind of killing. Or this from Dr. R., a former abortion clinic doctor. They, the women, are never allowed to look at the ultrasound because we knew that if they so much as heard the heartbeat, they wouldn't want to have an abortion. Or this from psychologist Vincent R. I have seen hundreds of patients in my office who have had abortions and were lied to by the counselor, namely, being told it is not a baby. Afterwards, the woman sees Life magazine and breaks down and goes into a major depression. Also, President Obama, are you aware of the brutality of the abortion procedure itself? I wasn't, and was shocked when I found out. Again, listen to these words of former abortion clinic workers and doctors. I warn you, though, the following testimony contains descriptions of scenes which are disturbing and are not intended for young viewers. Like this from Dr. David B. from Northern Illinois. One night a lady delivered, and I was called to come and see her because she was uncontrollable. I went into the room and she was going to pieces. She was having a nervous breakdown, screaming and thrashing. The other patients were upset because this lady was screaming. I walked in, and here was this little saline abortion baby kicking. It had been born alive and was kicking and moving for a little while before it finally died of those terrible burns. Because the salt solution gets into the lungs and burns the lungs too. I'll tell you one thing about the technique of dilatation and evacuation. You never have to worry about a baby's being born alive. I won't describe D&E other than to say that as a doctor you are sitting there tearing, and I mean tearing, arms and legs off of babies and putting them in a stack on top of the table. You need a lot of strength to do it.